Hello.
Okay, I'm gonna share on my Facebook real quick as well. Okay, I guess we'll get started. When Kelly's ready.
I'm good whenever you are.
Okay, I guess we'll get started.
Okay, great. And so good afternoon, everyone. I am very pleased to welcome you all to our seminar today. It's titled Centering Indigenous Peoples' Health and Wellness. And my name is Kelly Thompson. I am the director of the Catherine M. Buder Center for American Indian Studies, and we are located at the Brown School at Washington University in St. Louis. And at the Buder Center, we support Indigenous students, but we also develop programs to support these students and also our community. And the seminar that you'll hear today is meant to provide really important and timely health and wellness information regarding COVID-19, places where you can get tested, what to do if exposed, vaccine information, and other important culturally relevant topics that you'll hear from the speakers today. At the end of the seminar, you will be asked to fill in a survey to receive a COVID-19 care package. And this will be mailed to you, or you can pick it up. And this will include hand sanitizer, different soaps, multi-purpose cleaners, and face masks as well. And so the supplies for these items are limited, so please be sure to fill in this survey. And before we get into the event, I'd like to thank our project funders, the A&B Foundation, who support Indigenous peoples of the Americas across the country. And I wanted to mention also that we're broadcasting on 2 different virtual platforms through Zoom and on Facebook Live. And so I'll ask that if you have any questions for our 2 presenters to please post these in the chat if you're connecting with us on Zoom, or post these in the comment section if you're connecting with us on Facebook. I'll collect the questions and I'll share and ask these with our presenters towards the end of the presentation. And I have the pleasure now of introducing our 2 speakers today, Kelly McCall and Lindsay Manchak. Kelly McCall is a 3rd-year MSW MPH student at the Brown School and a member of the Cherokee Nation. Her interests lie in culturally appropriate preventions and interventions with Native populations, addressing substance use disorders, suicidal behaviors, and historical trauma. And Lindsay Manchak is the research manager at the Buder Center and is a member of the Choctaw Apache tribe of Ebarb. She earned her MPH from the Brown School and is a PhD student at the University of North Dakota, studying Indigenous health and focusing on American Indian and Alaska Native cancer experiences. And I welcome our presenters and I thank you for presenting this afternoon.
Thank you, Kelly. So we want to start by acknowledging that wherever we're listening in from today, for me, this is in Missouri, um, that we acknowledge the land that we're on is the ancestral land of Indigenous people. For me, it's the Osage, the Illini, and the Missouri Oto. We thank them for their stewardship of this land, and for all the Indigenous people who are still on this land. We thank them for their stewardship as well. So, as Kelly mentioned, I'm the research manager at the Booter Center. And my work really focuses around student involvement and research for the Booter Center. And I have the honor of presenting today to share more information about COVID-19 with everyone. Um, this is a subject that I'm really passionate about, um, specifically because my dad has just recently recovered from COVID and he's still on his journey of wellness. And I'll be bringing in any of that information and sharing some tips that we went through, but we'll also be sharing a lot of guidelines through the CDC as well. So I'd like to open it up to Kelly to introduce herself and speak a little bit to her background.
Thank you, Lindsay and Kelly. As Kelly mentioned, I am third year MSW MPH, and recently my research is centering around certain substances for my thesis, mainly psilocybin, alcohol use, and how it relates to suicidality with AIM populations. So I'm very passionate about it, and I love to give back to my community as much as possible. So I do that through my research. And I am a member of the Cherokee Nation, as Kelly said.
So today we're going to really talk about how to prevent the spread of COVID. I'm sure you've all heard a lot about preventing the spread, but we're going to go into more details. And we're going to talk about tips to reduce symptoms if you're exposed to COVID as well, as some locations to get COVID tests in the St. Louis area. We're going to talk a little bit more about contact tracing and what that means in public health, and finish with some vaccine updates before we give you the information for the care packages. So COVID-19 or coronavirus is a respiratory illness caused by the coronavirus. It hasn't been found in humans before, specifically this novel coronavirus, and it can lead to lower respiratory illnesses like pneumonia and bronchitis. Most of the time, the mortality rates that we are seeing from COVID are specifically from pneumonia and bronchitis and not directly be caused by COVID-19. So it's the bacterial infections that COVID-19 causes that actually can lead to mortality or very sick, being very sick. We're giving this talk specifically because American Indian populations have been hit pretty hard by COVID in terms of incidence rates. They've been disproportionately affected with infection rates over 3.5 times higher than non-Hispanic whites. In addition, American Indian individuals are 4 times more likely to be hospitalized as a result from COVID. And there's many reasons that we see this. We know that American Indians have higher rates of health disparities in general, and those stem mostly from social determinants of health. So where you live, where you work, what you have access to in terms of transportation or healthcare. When we first went on lockdown, and when we first started learning about coronavirus at the beginning of the year, the CDC was very adamant: make sure you wash your hands with running water for 20 seconds and use soap and water. And in some of our Indigenous communities, running water is not a luxury that they have. And so using 20 seconds of water is either choosing between doing laundry for that week, or drinking your water for that week, or washing your hands. And so they had to make difficult decisions um, at the beginning of the pandemic. In addition, we have cultural differences. We have generational family households where you have cousins and brothers and sisters and aunts and uncles and grandparents all in the same household. And so if one person brings that in, it's going to affect the larger part of the family. And that was unique to Indigenous populations and other minority populations. And so we saw this as well. So speaking a little bit about the spread. So COVID spreads very easily between people who are in close contact, usually within 6 feet. And this 6 feet is sort of an imaginary distance that was created to be like the minimum amount that legally we can say. If you can maintain a farther distance away than 6 feet, then you're going to be much less at risk than you are within 6 feet. And it also depends on if individuals are wearing a mask or not. And so we'll go into that a little bit in the presentation as well. COVID is spread through respiratory droplets when an infected person sneezes, coughs, breathes, sings, or talks. This is because the respiratory droplets will move at a a faster speed, and they can spread more if you're doing certain things. So if you're just sitting and talking with someone, and you're within 6 feet, you're going to be less likely to have the virus spread directly to you. Whereas if someone was yelling or singing at you, those respiratory droplets are going to be coming at you at a higher velocity. You're more likely to inhale those. So there are a lot of different variables in play whenever COVID has been spreading. But yes, it does depend on the situation you're in. If you're talking with someone, or if you guys are outside and things like that. So we'll go into that. Respiratory droplets cause infection when they are inhaled or deposited on a mucous membrane, such as those that line the inside of the nose and the mouth. So the droplets from one person will come over, they'll hit you on your lips or your tongue, or you'll get them on your hand, and then you'll touch your nose or you touch your mouth, and those respiratory droplets will be transferred over to you. You will absorb them, they will go into your bloodstream. And that's when COVID will start to replicate itself, and you'll have a positive test result that you have COVID. People who are infected but do not have symptoms can also spread the virus to others. So this was something that is pretty common, and one of the most common ways is to spread COVID is most people don't know that they have COVID. I was just getting a haircut recently, and the hairdresser was like, "Oh yeah, I'm sorry, I didn't mean to have my mask below my face." And she was like, "Well, I'm not sick, so it doesn't matter." And I was like, "It definitely still matters, even if you don't have any symptoms or any sickness at all." So there's a lot of confusion about that, but we'll go into what it looks like whenever you're asymptomatic as well. Okay, so the guidelines: wash your hands often. So CDC recommends at least 20 seconds with soap. You may have seen there's a few different illustrations out there about exactly what to wash, but you wash the front of your hands. They say to wash the back of your hands, in between your fingers, your fingernails, all the way up to your wrist for 20 seconds. And they say to do this often. They actually say to wash your hands before you put your mask on and directly after you put your mask on as well. If you don't have access to hand soap, you can use an alcohol-based hand sanitizer, and it should have at least 60% alcohol within it. And that can be effective if you don't have access to running water, or if you're just getting groceries and you get back to your car. So we, in our care packages, we have hand soap that we can send you, and we have alcohol-based hand sanitizer that we'll be happy to send as well. Avoid close contact. So what does close contact mean? And it really depends on the risk of what each person is taking. So if you're immunocompromised, you don't want any contact with individuals at this time, especially if they're not wearing a mask. And so, maybe some of you experienced, Thanksgiving was very different this year. We had to make a lot of choices about not seeing our family or seeing them virtually. And this was a really great way to stop the spread through avoiding close contact with individuals. Wear a mask, cover your mouth and nose. We're going to go into what a good mask looks like, especially if you're used to wearing a cloth mask. But the mask should cover your mouth, and it should cover your nose, because that's where those membranes are, where the transmission can happen. So cover your coughs and sneezes. Just like what they say around flu season, sneeze into your arm. That'll stop the spread. That'll stop it from going out into the air in every direction. It'll be one direction where you're sneezing down. I don't know if anyone's experienced this, but it's weird to sneeze while you're wearing a mask. I've actually had that. And so we're all experiencing really strange things right now, but definitely cover your coughs and sneezes. There's some places you can go and they have you wear a mask the whole entire time. But if you're eating or drinking, they say, oh, you can take your mask off for a little bit. But whenever you need to cough or sneeze, make sure that you grab your mask and you sneeze until you're into your arm or into a napkin or something like that. Clean and disinfect. So the common surface areas that you touch pretty often within your home will be one of the most important places um, to stop the spread. So this could be any door handles that you have, even your car handle door, your toilet seat handle, any common surfaces. So COVID is spread very, very easily. And this will be just a really great way to make sure that we stop the spread. And so finally, not finally, but monitor your daily health. Kelly will get into this a little bit whenever she talks, but it's important to monitor your daily health. If you see any changes, to look at some of the symptoms that Kelly will be sharing here in a little bit. But maintain eating properly. A good diet will make sure that your immune system is high so that you can fight any infection that you may have. And get your exercise whenever you can in a safe way. Maybe not going to the gym, maybe avoid those areas, but if you can be outside, I know it's getting colder out, but that's more reason to wear a scarf around your face as well. So receive your flu shot. So you can get COVID and you can get the flu at the same time. If you have COVID, you have flu-like symptoms. So it's basically the flu times 2. It really runs your system down. And most of the time, flu shots are covered with your insurance. If you have insurance, but if you don't have insurance, I believe that you can go to Schnucks or Walgreens and get a flu shot as well. Okay, so the levels of risk. So if you look on the right hand side, how effective are masks? This is an illustration that I've seen commonly being shared around. At the top, it says high risk of transmission when 2 people are within close contact and neither one of them are wearing a mask here. So COVID is being spread in between individuals, or let's just say germs or respiratory drops in general. But if one of these people is positive for COVID and they may be asymptomatic, that's high risk. So if you go down to the next level, medium risk. If just one person is wearing a mask and the other individual is not, they may have COVID. And if they do, they're spreading that. You have a pretty medium risk of transmission. And if you're within close contact. If one person has COVID here, they're wearing a mask, but this individual is not, you have a pretty low risk of transmission. The mask really is effective, up to 90% or higher effective in stopping the spread. So if you are feeling sick or you're having a weird cough or you just feel a little bit different and all the time, make sure you're wearing your mask. And encourage other people to wear their mask as well. So if you're going, if you're within 6 feet, but they're like, oh, we're in 6 feet of a distance, should I put my mask on? Just go ahead and say yes, that would be great. Since you don't know if you have COVID until you start developing symptoms. Very low risk of transmission. When 2 individuals are both wearing a mask, one of them has COVID, you can see that this is a very low risk. If you go down one more and you're not within 6 feet, you're further than 6 feet, then your risk is virtually zero risk. So let's say you're in the grocery store, and you maintain 6 feet distance, and you go in and you're getting your groceries, you're never within 6 feet of someone, that and other people are wearing their masks, then you have zero risk of getting COVID. So this is why it's so important, and why the CDC has the guidelines of, and have said in the past, that masks are our best protection. One thing that this illustration does not go into is how the level of risk changes depending on the individual. So the level of risk refers to the chance that harm may occur and the severity of that harm. So for some of these individuals, they may be young, they may be very healthy, they may have never had any prior illnesses. And so their risk is going to be low in general. If they get coronavirus, they'll probably be okay and be able to get through it with only mild symptoms. But if you're an individual who has had any of these issues in the past, COPD, heart disease, high blood pressure, diabetes, or any family history of cancer, of other chronic illnesses, you want to be more mindful that your level of risk is very different than the next person's. You can never really assume what other people's level of risk is. And that's one thing that this illustration doesn't really show. So even here, on low risk or very low risk, if one of these people is a person who's more prone to getting sick or is not as healthy, they have a higher risk than this illustration shows very low risk. So make your decision for yourself and what's best for you and what's best for your family, especially if you know that you have someone at home who gets maybe has chronic illnesses that they are dealing with. So it's also about respecting other people, and respecting their right to being healthy. So moving over to face masks. It's been one of the many questions that has been going around. What is the most effective fabrics to use cloth masks? Well, the CDC recommends tightly woven fabrics such as a cotton or a cotton blend. They want it to be breathable, and they recommend 2 to 3 layers on that mask. And the reason that they want it to be breathable seems so obvious, but it's really not, I don't think. They need your mask to be breathable so that you're not tempted to pull it down under your nose to be able to breathe. So if you have a mask that's like really, really thick and you don't think you're going to get it, but then you have to pull it down at any point, you're going to be able to get COVID like immediately, just as you would if you didn't have that like really intense protection around your mouth. So make sure it's a breathable cotton, that you can wear it safely above your nose and all the way down your chin. And that's why it's so important to get a breathable mask. And they can be hard to come by as well. So you may have to go through a few different masks until you find the right one, the right fabric, the right fit for you. Non-medical disposable masks should be a single-use mask. It shouldn't be worn more than one time. Once you're done with it, throw it away. I've seen that they can be really expensive for those, up to $30 actually, for a pack of like 10 or 12. And so I personally use a cloth mask. The CDC recommends that you wash your mask every time you use it daily. I think that's a lot of washing. So it might be good to have quite a few cloth masks on hand, so that you're not tempted to use the same mask over and over again, which is pretty common, pretty regular thing that most people do, I think. So if you can go above and beyond and wash your mask every day, it's just going to be a good feeling. But again, not everyone has access to water, running water, washing machines, things like that. So disposable masks might be better. And we have masks that we're able to give out. So go ahead at the end of this and fill out the forms. Finally, the CDC does not recommend masks with exhalation valves or using face shields as a mask substitute. So masks with exhalation valves can actually transmit COVID pretty easily. And so they do not recommend using those with the valves on them. And then secondly, face shields. I've gotten a lot of questions. I can't breathe with my mask on. Can I use the face shield and will I be protected? And the answer is no. You are not protected if you just use a face shield alone. If you use a mask and a face shield, you can be extremely protected because in addition to your mouth and your nose, you have membranes that in your eyes, and you can get the face shield will protect those membranes. So it'll be an additional layer of safety. Also, if I don't know this for sure, but if you wear glasses, I mean, I feel better that I wear glasses during this. Once I learned that you can get COVID through your eyes, I was like, oh, thank goodness. But I'm not sure. I haven't seen any studies on that. Maybe, Kelly, maybe you can do some of those studies. All right. So, Kelly, please tell us more about what to do if you're exposed to COVID-19.
Okay. So, like Lindsay was saying, some people are asymptomatic. In fact, we're finding out that most people are asymptomatic, and that's leading to a big spread, a big spike in numbers as well. But if you know you've been exposed, it's pretty common to know that you need to quarantine for at least 14 days. Recent studies have come out where you might be exposed, but the symptoms won't manifest till later, so you won't even know, and you could have already spread it around. So if you know you're exposed, just make sure you stay home for 14 days. I know it's hard if you have to go to the grocery store, things like that. So maybe getting the community involved and asking, your neighbor or your friend to drop off some groceries for you or things like that. We can get creative, but you definitely want to stay home for at least 2 weeks. Plenty of rest. It's a serious illness, so you want to stay rested. You want to stay hydrated. You definitely that will just strengthen your immune system. That's how our body naturally will heal itself and gain more strength, more resiliency. Like Lindsay said, in public, maintain 6 feet at all times if you can. I don't know about y'all, but when I've gone to the grocery and somebody's walking right down the same lane as me, I panic. And so I like instantly try to swerve around to get around people, and they look at me like I'm crazy, but that's fine. You can look at me crazy all you want, but try your best to do that. Or if you see there's like a crowded aisle, I've just tried to move around it. So we've just had to adjust and be flexible, especially just in public places like that. Again, wear masks, filters if needed. So I know there's a lot of like you can get them on Amazon that are filters that go in between the slits of your mask. I've known, like my mother, she refuses to spend any extra money, so she uses like coffee filters in there as well. So we can get creative, but I know that that's another barrier that you can have as protection, especially if you know you've been exposed. So again, the CDC recommends you check your temperature twice a day, and they consider a fever around 100 degrees, 100.4 degrees or higher. I think this depends because personally, I have a lower body temperature. So mine's around 97.6, it ranges around 97. So if I had a temperature of 99, that's a fever. That's high. And it doesn't quite hit that 100 mark. So it might be a good idea to just go ahead and check your temperature in general and know what your baseline is. So that way you can judge for yourself. Some people know when they have fevers, they get the chills, little cold sweats, but it's good to know your baseline first, to know exactly when you believe you would be having a temperature, because you definitely don't want to get it too high. That causes serious health injuries, especially neurologically. So, but the CDC does recommend 100 degrees, 100.4 degrees or higher. So if you are exposed, you want to watch for signs, and you got your cough, you got your flu-like symptoms, sore throats, runny nose. So it's like you're having a cold, a flu, all in one. And the main symptoms that are unique to COVID are, well, shortness of breath isn't really unique to COVID, but you will have shortness of breath and you find it hard to breathe. And there's the loss of taste and smell. So I should specify that if you have a cough, just because you cough once doesn't mean you have COVID. It has to be a continuous cough that's, really affecting you and your chest and your respiratory system. So just because you cough, I know that happens to me all the time. If like you cough in public, everybody looks at you and panics and you're fine, but if you're continuously coughing, that's an issue. And as far as like the taste and smell, I like to, if I am snacking throughout the day, I call it my hourly COVID test. I'm just making sure I can taste everything. So, but that is a main symptom for COVID. So those are things you want to really look at. If you know you've been exposed, just be a little bit more hypervigilant on these specific items. All right, next slide, please. All right, so if your symptoms do continue, you definitely want to contact your healthcare provider. Now, they're recommending that you don't go directly to urgent care. Because a lot of times your symptoms are mild, your physician can get you started on medications, antibiotics, steroids, things like that. So you don't have to go directly to the urgent care. As we know, our medical facilities are just way full right now. And so the less you can go, the better. But again, if you are having that shortness of breath, if you get to your healthcare providers. That's what they're there for, to help you. But a lot of times they're just recommending, if you are having the mild symptoms, to go ahead and call and they can take care of you and you don't have to be admitted or actually physically seek medical care. But again, if they're continuing and they're worsening, you definitely want to get help with that. And overall, stay home. I know it's hard. We're all having COVID fatigue. Even me as an introvert, it's getting harder and harder to stay home, but it really is the best thing to do. And I know that's really hard, especially now during the holidays. That's the time for families to gather and celebrate, but it's really important to just try to stay home as much as possible. And again, take care of yourself. Lindsay mentioned eating healthy as much as possible, hydrate, sleep, especially exercising. I've gotten creative as far as like an exercise bike at home that you can get them pretty cheap on Amazon, around, just a couple $100, so you don't have to break the bank, and little mini trampolines to jump around on. So, but definitely try to take care of yourself as much as possible, especially since it is getting colder and it is rounding around flu season anyway. So those are a couple things to do if you know you're exposed.
So I would love to share a little bit about what we did whenever my dad had COVID, whenever he got COVID. So my dad was diagnosed because his first symptom, he lost his sense of smell and sense of taste. So he immediately called the doctor and they said, let's get you a COVID test. And he had to wait. So this was on a Friday. He got his positive result on that Sunday. My dad has a lot of lung conditions already and other issues that he deals with, high blood pressure. And so it was really scary. But he went ahead and called his doctor and told his primary care doctor that he had gotten a positive result. And his doctor immediately started him on steroids and antibiotics. COVID, there's no treatment for COVID-19 itself. It hasn't been developed yet, but the steroids and antibiotics were used to prevent pneumonia and other respiratory, like intense respiratory failure. And those drugs are something that a doctor may give you if you have COVID to prevent that. And it's up to the doctor's discretion, but it's good to know that that's an option. that could happen that could possibly relieve some of those side effects from that COVID would cause. My dad was in a hotel room by himself for his 14 days up to 20 days alone. And he was out of state because he works out of state. And so, how do you provide care to individuals who have COVID if they're not living with you? And one of the things that we did was we used food delivery services and DoorDash. I was able to DoorDash him a thermometer from Walgreens and send it to him at the hotel room. And then they can drop it off in front of their door so that there's no contact between those individuals. I also dropped off Pedialyte, some soup for him. And that was really, really helpful. So if you're in an area that you can use some of those services, I'd highly recommend it. Sometimes just, food is the best medicine. Even if they can't eat it, it's still soothing. And so, but because he had experienced some of those antibiotics and steroids, they were really intense on his body. And so we tried to look up some ways that he could get some relief from those and came across this immune and respiratory herbs, a resource for tribal communities during COVID-19. So this is a resource that some Native community members have created to be shared. And this document, here's just a quick list of some herbal supplements, supports that you can use that are from traditional plants and medicines. And so for fever, cottonwood bark, elderflower, antiviral, cedars to soothe cough. You can have some honey, marshmallow. All of these things are really, really powerful traditional medicines. So although we don't have a treatment for COVID, we have a lot of traditional knowledge to help alleviate some of the symptoms, and it's powerful. So even if you don't have COVID, I would highly recommend, I think we're going to share it in the chat here, and we'll share it in materials on our Facebook website too. It's free to download. It's something to just put away in your medicine cabinet in case you get sick in the future with a cold or anything like that. It's a great resource to have. But yes, I would highly recommend Pedialyte. It has less sugar than Powerade, and if you want to stay hydrated and keep your electrolytes.
And also I want to add, Lindsay, we were just talking about this, but another good thing to do to remember is when you are resting to lay on your tummy, because that it allows for the drainage and the mucus to not get settled back in your lungs. And so I believe Lindsay confirmed that. And so if you can, try to lay on your tummy. It seems like if you lay on your back, it would open up your lungs more, but it's the opposite. So definitely try to lay on your belly if you can.
Yeah, that pneumonia can develop from being settled in the back and lower part of your lungs. And yes, it's a technique called proning that if you do go into the hospital, that's one of the first things that they'll have you do is move your body up so that your lungs can drain and give them some relief. So yes, that's a really good point.
So we're just going to briefly touch on this, on where to receive local testing results. And I want to preface this by saying that since there seems to be a spike and there seems to be a lot of testing going on right now, it was originally around 48 hours to get test results back, but now it could be as many as like 5 days. So just keep that in mind as well. Another reason you definitely want to just stay home, try to do all those preventative measures to avoid that, but definitely keep that in mind. Also, there are there's a couple ways they do the nose swab. I know they do saliva for sure, and those seem to be the main testing strategies. So if you are concerned and you do need to go get testing, these are something, well, Walgreens and CVS are not just local to St. Louis. These are everywhere. And I believe we'll go into this later, but they're around $100 if you don't have insurance. And we'll go into more detail on that later. But Walgreens, CVS, here's their main sites. You have to call ahead and reserve a time to go in and get these taken care of. Local to St. Louis, the main ones tend to be Afina, Mercy, and Total Access Urgent Care. Those are the main ones. And again, you can call and make appointments and they will get you in and get you tested and make sure that everybody's staying healthy. We will have a comprehensive list of these sent out with the resources, with addresses and phone numbers, so you can get it in your area. But here are just the websites. I don't know why one's not highlighted, but anyway, these are the websites that you can go to, and these facilities will take care of you. So now, as far as Total Access goes, these are all over St. Louis, but how it works is they are around $100 to be evaluated and tested, and those are two separate things. So, but Total Access will, once you're paid for, you will get refunded via the CARES Act. And this is going to, it's the government, so it takes about 6 to 10 weeks to get that reimbursed, but that does not cover your evaluation fee. So this is just for being tested. And they will, and this is as long as you don't have Medicaid. If you do have Medicaid, that does cover the cost of COVID. Any testing is sent to, is going to be billed to Medicaid, so you don't have to worry about that. But it doesn't cover the evaluation fee again. So that's just kind of the billing process that's going to happen. And then any billing will be sent to you directly, but after that. So is there anything you needed to add on this part, Lindsay?
Nope.
Okay.
Nope.
So that's a little bit about that. And again, we'll have a more comprehensive list in the resource
Yes.
as well.
Yes. There's an awesome list that you can get to get all of this information. Okay, so we're going to go into a little bit about contact tracing. Contact tracing is a very common public health technique that is used to stop the spread of an illness or a virus or anything like that. It was really common to stop HIV transmission, and that's whenever it was first introduced. And so for us now, it's really important to have contact tracing. So we're going to go into what that means. So in case you ever get COVID or someone you know, public health department is probably going to call you up, but this is going to be the process that they use. So you have a confirmed case. They're going to recommend that you isolate and provide care. Now they're going to ask people, there may be people in your contacts who are starting or who haven't shown any symptoms. If contact shows no symptoms or contact shows symptoms. If you have a contact that you've met with who is showing symptoms, they're going to go ahead and say, you guys need to isolate and care as well. They're going to ask them about their contacts, and they're going to go on so forth with that until they receive no new patients. If you have COVID, they're going to come to your contact. They're going to make sure that your contact is in isolation for 14 days. This has changed rapidly. Now it might be only 10 days or so that you need to remain in isolation. It'll be up to the discretion of your local county if you're in Missouri. So if that person shows no symptoms, there's no more contact tracing. They're not going to reach out to anyone that this person knows until if they were to receive a positive case. They're going to be people that are missed. So they factor that in terms of we're anticipating that you don't know every single person that you come in contact with. And so some of those people you may be around by a grocery store or something like that. There's no way to know about those people. So there are some people lost to follow up. And finally, if your contact shows symptoms or test positive, they go into isolation. The public health department will ask them who they were around. If they were around no contacts, then there'll be no further spread. So they'll stop contact tracing at that point. So it's basically just identification of people who may have come in contact with an infected person. The vaccine is a really popular topic right now. It's something that the CDC and the Indian Health Service has planned for. And so here you can see the Indian Service has a COVID-19 vaccine task force. So if you get your services from IHS, so if you're from a federally recognized tribe, you'll have access to this. But this is their framework. So their task force has already begun planning for vaccine administration, for communications on how they want to get the word out to members to tell them where they need to get the vaccine, how to manage the data once they are starting to give people the vaccine, and then if the vaccine's working properly, they're going to monitor that. Distribution to different tribes. So different tribes, different IHSs serve different locations. So they've factored in how many doses are going to go to each of those IHS locations and how that'll be distributed out. And then prioritization. So all of those things have been planned for within the Indian Health Service. And there's going to be more information that comes out once that's available. There's about 8 things that the CDC really wants everyone to know. They want to know that safety of the vaccine is the most important thing that they're focusing on right now. So what we have found is that the vaccines that have been tested are extremely safe, which is great. And hopefully they can get those out pretty quickly. But that's been their number one priority, is the safety of the vaccine. Many vaccines are being developed and tested, but some might be ready before others. The CDC is planning for many possibilities. I believe that there are 3 vaccines out now who have shown really positive results. They're in the phases of going through the final stages of getting approved. Once they're approved, they'll be shipped out across the states. And it'll be up to the states on how they distribute that within their public health departments. At least at first, COVID-19 vaccines may be used under the emergency use authorization. So this is how they can have a speedier time to get these things approved. There may be a limited supply of the vaccines at first before 2020 ends, but the supply will continually increase in the weeks and months that follow. If there is a limited supply, some groups may be recommended to get the vaccine first. So this is probably going to be healthcare workers, people who work at nursing homes, and even people who are in nursing homes, and elders. Maybe the very sick, such as cancer patients, may get the vaccine first so that we can protect our most vulnerable populations. And at first, COVID-19 vaccines may not be recommended for children. This is something that they just like to share. They're still going to be doing the testing, of course, to make sure that the safety of the vaccine is most important. The CDC says that the cost of the vaccine will not be an obstacle to get vaccinated against COVID-19. So that's really promising, so that we can have everyone be able to have a COVID vaccine and not have any worries about it costing them anything out of pocket. And finally, COVID-19 vaccine planning is being updated as new information becomes available. So if you look at the flu vaccine, I think there's a lot of fear right now on the vaccine coming out. And if you're in the first group to get it, can be scary because of just how crazy this year has been. But if you look at the flu vaccine, there's a new flu vaccine that comes out every year. And not many people question that. It's kind of like, oh, I'm going to go get my flu vaccine this year. And you don't look back like, oh, well, where, how did they develop it? Who did they develop it on? How did they come to this conclusion? And so I think it's just good to be mindful that this year is, we've been very fearful of that, and there's reason to be, for sure. But it's also a good reminder to trust our public health officials and our doctors and our scientists and our nurses, that they're doing everything they can to keep us safe. Kelly had pointed out a really good point. Kelly, did you want to share about how it can be distributed and what that looks like?
Oh, yeah. Dr. Fauci was speaking just a day or two ago, and he did mention that there is a plan for the government to disseminate the vaccines. They're disseminating like 1 billion through the U.S. Armed Forces, and they know how to transport these, and they can do it in a safe manner and get them out quick. So from the government to the states, there is an incredibly safe and efficient plan in place for that. And then once it gets to the states, it's up to the states. I believe Lindsay mentioned this, how they're going to disseminate the vaccine. But the states are very competent in that they've done this with the flu vaccine, so that there is a process that they can follow. But as far as getting the vaccine to us all safely, there is a comprehensive plan that they have that involves safety, getting the vaccine to us safely and quickly, and making sure that that's good. So he did just mention that the other day.
Yes. So this brings us to the COVID-19 care package. We're going to open it up to questions right after this, but I wanted to go into detail about how you can get this care package that we have. If you or your family are in need of items listed in this picture, so we have hand soap, hand sanitizer, we have masks, we have all-purpose cleaner. There's a survey that we're going to be providing very soon, shortly in the chat. And you can fill out the survey, you can add your mailing address, or you can choose to pick it up from the Booter Center at WashU, or if you know anyone within the Native Women's Care Circle, they can also collect that information and distribute that as well. We want to give a special shout out to the Booter Center students and alumni for working to identify the items that are most needed within the community, and these are the items that they have identified. So let me make sure, let me see if it's in the chat. If it's not, I want to get that in there as soon as possible. And we want to open it up for questions. I believe Kelly had shared with me that one person had a question from the Facebook Live. So they said, let's see, that this is a lot of washing for masks. When I mentioned that it's, you know, a daily wash every time you wear it. What type of detergent is recommended if you decide to hand wash your mask? So I looked this up because I wasn't for sure. And what the CDC recommends is if you have a washing machine, to just go ahead and use your normal detergent on regular washing method. And if you're doing it by hand, to go ahead and use laundry detergent by hand and dry them. So great question. They don't say any specific type of detergent, but they just say use whatever you have available.
I've been using a lot of the soft, gentle, like they have all or Tide that are for sensitive skin, because it tends to be a little bit easier on your face that way as well.
Great, thank you. We have a couple more questions for you both. And the first one is, do we know how COVID-19 vaccine trials have or have not included tribal communities?
So the COVID-19 vaccine trials, there have been quite a few efforts to make sure that tribes are included in decisions being made about the vaccine. There's a few tribes in Washington state that have partnered with their local hospital systems, who the hospital systems themselves have partnered with Pfizer and the CDC. And that hospital system has been very close with working with their tribes in the area. So when they were asked to have a vaccine trial in Washington state, they reached out to tribal council leaders in their state to ask them, do you want to be part of this vaccine trial? And that has been one way that the government and the vaccine has been involved tribes, and it's been up to the tribes to if they want to be involved or not. So some tribes are still deciding if they want to be involved, and that's going to continue because they're going to continue having trials. And in some ways, people see it in different benefiting different people. So the tribal leaders who have made some of those decisions think it's in the best interest of their members if their communities are getting the first testing of the trial. The vaccine is not just being tested randomly on tribal communities. The vaccine has gone through many, many stages. It's gone through animal stages, which is the first step of any drug treatment. And to make sure that it is fully safe before it's being used within any human experiments or trials in that way. So there are safety precautions in place, and tribal IRBs have been used very often. Sometimes they've been expedited, and so it's ultimately up to the individual if they want to be in a clinical trial for a vaccine, and that is within the informed consent that every individual before they take that vaccine will make sure that they know.
Also, I know the National Council of Urban Indian Health that oversees all of the urban Indian organizations for public health throughout the United States have been in touch with every one of those in each state to make sure that they're well informed so they can inform their community members about risks and benefits, that type of deal as well.
Great, thank you so much. And I think the link has been posted in our webinar chat, and we are going to get that up on Facebook in a moment here. But I have another question from someone, and this one is, if I am a caregiver for someone who has COVID, how can I safely continue being a caregiver to that individual?
Yeah. So what the CDC recommends in terms of caregiving for individuals, if you're just caring for someone who has COVID, or if you're a caregiver, like full-time caregiver for that person, I think that you'll have different recommendations. But anyone who is caregiving for a COVID patient, they recommend, if you have the capacity, to have that person stay within one room throughout COVID. So throughout their 14 days until they're able to get tested again, for that individual to stay in that room. If you have access to a second bathroom, that person should also use that second bathroom. If you're checking on that person, make sure that person, anytime you're face to face with them, as you may have seen in the illustration, have the COVID patient wear a mask. That's going to be the best way for you to maintain your protection, and you wear a mask as well. That would be I think the best recommendation. And it's very hard to do it within the family, especially if you don't know if that person has COVID yet. If you have any idea that that person may have been exposed, or you have, maintain quarantine until you can get your testing done.
Yeah, that's where you can kind of reach out and ask for help too. So kind of keep you both a little isolated as well, and see if you can get your groceries or any type of supplies that you may need delivered, like Lindsay was saying, DoorDash, or I mean, I know Walmart delivers, things like that, that try to, use as many resources as you can to also keep yourself contained as well.
Mm-hmm. Yes, definitely mask will be the safest bet within a household.
Okay, wonderful. And I think we have time for just one more question here. And this question is, what is the most common way people get COVID? And how can I avoid not being exposed if I continue to participate in that activity?
So the most common way is through transmission of respiratory droplets. And you can get COVID. Germs spread very easily on surfaces and if you touch your mouth, but most commonly is when an asymptomatic person exposes another person through those respiratory droplets. So to make sure that you're safe until we are able to roll out a vaccine or have some sort of treatment for COVID, maintaining isolation within your house and social distancing will be the best bet, but also your mask is like your number one form of protection, not only for you, but for protecting someone else. So don't go to places if people aren't wearing masks there. So indoors, don't go anywhere indoors. I would recommend not going there to maintain your protection for now. And it's really hard to do in terms of COVID fatigue, I know. So, but masks are our number one form of protection right now. So, what about place? So, can you elaborate on that, Kelly?
Sure. I think the question is, what are common places, right, where we can get COVID? Is it at the hospital, the doctor's office?
That's a great question.
Sorry, Lindsay.
Okay.
I know one of the main things that they've said is if you're out eating, that seems to be a main thing. I know that definitely, because you're exposed at that point when you're eating. If you're eating with family or anything to that nature, it's a big risk going in to restaurants, any type of thing of that nature where you have to pull your mask down to eat. I know that that's been a real big common place of spreading the virus.
Absolutely. And as well, one thing I can share is that my dad was very nervous about going to the hospital when he had COVID. He was starting to experience some shortness of breath. And you can get an oxypulse meter from the store. It's kind of expensive. It's like $30 or $40, but it can measure your pulse. So if you have your normal range is 97 to 99, if you get 94 or below, they say to go to the hospital. But besides that, the point of this is that he was nervous to go to the hospital when he had COVID because he didn't want to re-catch COVID. And I had to really explain to him that hospitals are one of the safest places right now because they're not allowing individuals to come in that don't need to be there. Number one, if you're going to the emergency room and there's a line, they don't have people waiting in the areas. You have to wait in your car directly. Everyone within the hospital is wearing PPE. As soon as you come in, you should be wearing a mask when you go in, but if you're not, they will put you in a mask. So doctors' offices, don't be fearful of those places. Those are not common places to catch COVID right now. The most common places is the grocery store or restaurants that you have seen, but and in more common areas. But if you have to go to the doctor for an annual cancer screening or your yearly checkup, those are still really important to go to, especially for minority populations. And if you're caregiving for someone, it's important for them to go get their treatments and get what they need so that they can be as healthy as possible in case they are exposed to COVID.
Okay, that sounds good. Thank you both so much for presenting on this very important and timely topic to all of our listeners today. We're out of time. So thank you again, Lindsay and Kelly. And I want to remind everyone to fill in the survey because we do have supplies and we want to make sure that those get out to you in a safe way. And feel free, if you have a family member who may need some of these supplies, feel free to share that link with them as well. And I hope everyone has a good afternoon. Thank you.